Good morning, everyone. Thank you for joining us for this webinar this morning. So my name is Catherine Nochlin and I'm working for the European Disability Forum, and we're a member of this Project Vivity. And the webinar we have this morning is Challenges in Inclusive Volunteering in COVID-19. So we're speaking to you now at 11 o'clock Brussels time, but we have colleagues coming from different time zones in different parts of the world to share their experiences. The main aim of this project is to create a community of practice made up of EU organisations working towards disability inclusion in humanitarian action and volunteering. The focus of the webinar is to present and discuss the topic of inclusive volunteering under particular challenges, such as COVID-19. The webinar will lead through the participants from the theoretical background to practical information. It will give recommendations based on both research activities and organisational experiences. And the participants will also have a chance to meet a volunteer virtually who is currently in service at one of the UN volunteers duty stations in New York. So has got up very early to be with us this morning. And there'll be an opportunity for questions and answers during our discussion. The webinar will provide real-time captioning and international sign. So we have Wim with us on captioning and Lisa and Gardinand with international sign. If you have any technical difficulties at all, use the chat box and my colleagues will help you with any technical problems that you have. The webinar is also recorded and will be shared later for those who cannot join, and we will share that information. You will also receive a survey, which we would really appreciate if you would fill in so we can be improving all the time on how we manage and run these webinars. And you're also able to download the 3 presentations of the speakers as well in the handout section here. Again, if you have any difficulties, just tell about it in the chat box and we'll be able to, Raquel and Diana, who are helping with the organization of the webinar, will be able to help you out. So with all of that practical information, I want to tell you a little bit. I need the next slide, I think, for the housekeeping rules. Is there another slide with more details? I just want to make sure I haven't missed anything. Okay. So then I'm going to move to the first speaker. So we're going to hear first from Charlotte Thumser. She's the Volunteer Programme and Advocacy Advisor in CBM Ireland. She's going to introduce herself and she's also going to share her own slides. Charlotte, you have 15 minutes and we're going to be very disciplined with all of the timekeeping so that we manage to get to questions and answers at the end. So I give you the floor, Charlotte.
Okay,
Are you
perfect.
able to turn on your mic and you're able to turn on your camera?
Yes, can you see me and hear me? Yeah.
Perfect, yes. I'm going to turn off my camera while you're speaking.
Perfect, and you can all see my screen now, I guess. Yeah, so as Catherine said, my name is Charlotte and I'm actually on a volunteer position within CBM Ireland looking at programs, and one of my main assignments was to support the VIVID project by compiling this report. So I'm very happy to be able to present a little bit about this today. It's looking at international volunteering and disability more broadly and not specifically in the context of COVID-19, which I believe we will hear more about later on. So yeah, first of all, yeah, this was prepared in an Irish context, but also looking at the frameworks more broadly, which can be applicable globally, and it presents learning and experiences that will be relevant to all sending organizations. Here a quick overview over the content and the prepared for this presentation. I'm going to start by introducing some key concepts and terminology, then look at volunteerism and its importance in the era of sustainable development, and then I'll come to inclusive volunteerism, talking about the benefits and the barriers, and finally provide some recommendations or key learnings to sending organizations. At the end, I also included some resources which might be interesting to follow up on. So looking at key concepts, we're looking at disability from a rights-based perspective and understood as an evolving concept that results from the interaction between persons with impairments and their attitudinal and environmental barriers in that hinder full and effective participation in society on an equal basis with others. Inclusive volunteering is based on the concept of inclusion, and inclusion here is understood as a full and effective participation of all persons in all aspects of life. And this concept of inclusion, especially in international development context and in humanitarian assistance, is based on the Convention on the Rights of Persons with Disabilities, and they're looking in particular at Article 32, which urges that international cooperation, including international development programs, is inclusive of all and accessible to persons with disabilities. And this very much also includes international volunteer services, which form part of international development programs. Other articles of the Convention relevant here are Article 11 and Article 24, looking at humanitarian emergencies and education. Volunteerism.
Charlotte, could you slow down a tiny bit?
Yes, of course. Sorry.
Thank you.
Okay. Looking at volunteerism for sustainable development, and even the Agenda 2030, which sets out the SDGs, which I think most of you will be familiar with, recognizes that volunteering and volunteerism is very, very relevant to achieving sustainable development. And here I would like to read out a quote that is from the Agenda 2030 itself. It says that social cohesion and trust is strengthened through individual and collective volunteer action, leading to sustainable outcomes for people by people. Very much emphasizing on the localization of the agenda and of the sustainable development goals. And one example coming from UN volunteers is that citizens can build their resilience and enhance their own knowledge base and gain a sense of responsibility through volunteering, meaning that both communities and volunteers themselves benefit very, very deeply from volunteering. And when we look at volunteering from a European perspective, and because the VIVID project is an EU aid volunteer project, it is very much understood as the capacity building for volunteers and organizations. So it's very important and highlights that this opportunity should also be open to all people, and including volunteers with an impairment. Okay, and then I want to come to more practical benefits and barriers. Looking at benefits. So I structured it in a sense looking first at benefits of volunteering for the host communities, before later on looking at benefits for the volunteers themselves. So in the communities, local communities can benefit from that engagement in a variety of different ways. And one of them is inclusive community-based solutions. So that means that people can be brought together through volunteerism, and the inclusive volunteer that is on an international assignment can support the development in a community-based setting. This can overcome barriers preventing persons with disabilities living in this community to achieve their full potential, and can really be a role model for others living there. Volunteers do have an own lived experience of engaging, for example, with disabled people's organizations, and they have a rich knowledge and experience to help others within the communities to overcome some of the barriers that exist. One of the most obvious things that comes to mind are physical barriers, but then volunteers can also help institutional and attitudinal barriers. An inclusive volunteer really can help generate a dialogue around disability, and sometimes in host communities, disability can be stigmatized based on different views, and this can prohibit a discussion about disability, where sometimes persons with disabilities in the communities become invisible. So the work of a volunteer with a disability can help to break these barriers and support local organizations with persons with disabilities to promote their own rights. Motivation and peer support is another very important factor, as volunteers through their deployment can support locals with a disability to achieve their potential, and they can learn from one another, while also volunteers without an impairment can learn from the rich experience of volunteers with a disability. Volunteers are able to draw from their own insight and perspective and bring in their own very valuable experience to reduce barriers. And skill transfer, finally, is one of the very important factors, as they can share their skills to, kind of when they're confronted with different situations with locals as well. And then looking at benefits for the volunteers themselves. Volunteering is a really valuable life experience, and living in a host community allows volunteers to gain rich and deep insights into culture, for example, and learn a new language, get accustomed to local culture and customs. And this is more than just a skills experience, it's also a life experience. At the same time, it's very important for example, career development, and upon the completion, volunteers might have enriched skills and better opportunities to find employment as well. A lot of the times when looking at different reports from organizations who engaged in inclusive volunteerism, volunteers that had completed volunteering services reported that there's increased self-confidence and that there is a further desire to engage in volunteerism, even in the countries where the volunteers came from. So now, after looking at the benefits, it's important to also recognize that there are a number of barriers to inclusive volunteerism. And I would like to start by presenting a quote that came out of a survey rolled out in the Irish context. We sent volunteers to some of the poorest countries in the world where there would be no facilities for impaired people. Work in very poor developing countries would be difficult on every level, I fear. This is a very strong statement based on the perception of physical barriers, and that was the most common perception of sending organizations that had not had previous experience with sending volunteers. I want to present a second statement, which is in a similar vein. Some placements are even difficult to get to by foot or require local transport, which is difficult to get in and out of. So we are not able to recruit volunteers who need to use a wheelchair or a walking aid, for example. This really shows that those most obvious barriers are the ones that are most strongly perceived by sending organizations that would think about sending volunteers with a disability, but then feel that the barriers are just too much to surmount. Other barriers can include social barriers, institutional barriers, physical barriers, access to information and communication, and economic barriers. These are based on different frameworks, looking at the convention again, and looking at different reports that came from organizations that have experience with sending volunteers. Other things that were mentioned by sending organizations that we asked about their experience were that they have a lack of applicants, and only a few of them recognize that this might be linked to the fact that when advertising for a volunteer assignment, these advertisements are not made available in accessible formats, and they don't currently encourage persons with disabilities to apply. So communication is really one of the biggest barriers, as a facilitation of information via accessible means really can enhance the perception and the response from persons with disabilities. And other concerns that were brought forward included, again, environmental and infrastructure related problems, such as ensuring medication can be stored properly, or that climate conditions might not be suitable. But there's a lot of really opportunity to overcome and dismantle those barriers and to create accessible and inclusive structures. These structures will need to be ensured through all steps of the volunteering service, from really the preparation, even from the recruitment process through the preparation until post-assignment. And some of this can include, for example, making an advertisement or a volunteer opportunity visible to all, and really reaching out to persons with disability to encourage them to apply. Then in the application process, changes might need to be made to encourage persons with disability to apply to them, and also to facilitate that the application itself is accessible. Matching the volunteer to a post or assignment needs to be done very carefully, because all sites need to be aware of some needs that may be arise on the side of the volunteer or the post or the assignment site. Then there needs to be a lot of administrative and organizational training and preparation on both sides, and it needs to be ensured that there's always a contact person for the volunteer to get help with certain things that they might need. Then I wanted to highlight that communication is really one of the most important aspects, and this can include both the communication with the sending organization as well as how to communicate about the impairment with a receiving organization. Some adaptation to communication might be required, so that, for example, persons with a hearing or a visual impairment are able to also receive the information. And so I want to come to nearly the conclusion of my presentation, sharing some of the recommendations and key learnings that came out of the process of reviewing different policies and guidelines and different experiences of inclusive volunteerism. When we talk about inclusive volunteerism, it's very important to highlight the benefits of it, and also to focus on a right to inclusive volunteerism that is enshrined in the convention. This can really help to advocate for inclusive volunteerism and make other sending organizations aware of its existence. It's important to consult organizations that have experience to learn from their insights and receive some guidance. And it's equally important, or even more important, to learn from volunteers with a disability who have already completed their volunteer service. In the preparation of volunteers that are about to be deployed, it's very important to facilitate a peer-to-peer learning. So there is a direct exchange between those that have already been abroad and those that are about to be deployed. When looking at inclusive volunteerism, especially for the VIVID project, it could be helpful to provide some guidance and guidelines for sending and hosting organizations to facilitate that sharing of learned experiences and to maybe make it more easy to ensure a successful volunteer service. One of the barriers that came out of the research is the economic barrier, and it's linked to an increased expense to facilitate or to organize inclusive volunteerism. And it would be important to promote inclusive volunteerism with a sending organization and with the funding entities, so that it can be ensured that inclusive volunteerism can be supported financially as well. And then finally, it's very important to advocate for equitable access to both finance to cover additional costs, but also to the general participation in volunteering services. I hope I didn't speed through this too much. I just saw a comment there again. Yeah, and thank you very much for listening to that initial presentation. And if you're interested in hearing more about the topic and the other findings, specifically in the Irish context, but looking more at different barriers in more depth, CBM is currently preparing a launch of the report and a presentation, the webinar for the 12th of August, and more details should soon be available via our social media channels.
Excellent, thank you very much. In fact, Charlotte, I was able to follow your speech completely because having an Irish accent myself and a tendency to go too fast, I'm not really noticing it when other people do it. So I think then afterwards your pace was okay. So thank you very much for sharing. This was a basic presentation on inclusive volunteering and showed already that organizations, sending organizations have actually quite some preconceptions as well that could really put barriers and make them assume that inclusive volunteering is not possible and not see it as much as it could be as an opportunity. Now, our next speaker, Regina Fuchs, who's coming from bezev in Germany, is going to tell us about dealing with COVID-19 challenges in inclusive volunteering. So you're extremely welcome. Thank you very much for joining us this morning, Regina. You have 15 minutes for your presentation. I'm going to switch off my camera and mic so everybody can see and focus on you. You're very welcome to our webinar this morning.
Hello, everybody, and thank you very much. Can you see my screen now?
Yes, Regina, we see it perfectly. I just wanted to ask you, can you put the full screen mode?
Yeah.
Okay, thank you.
Coming. Hi, everybody. I'm very happy to be here. My name is Regina Fuchs, and I'm working with a Disability and Development Corporation, also called bezev, here in Germany. Thanks a lot, Charlotte, for your introduction. That was really very good and very giving me a lot of things to think about. I will talk about COVID-19 challenges in inclusive volunteering. Before starting to do so, I will give a short introduction about who is bezev and what we are doing. So bezev was founded in 1995 and since then is working as an NGO and is very committed to a fair and social world, promoting an inclusive development. And we strongly support the role of people with impairment as active players towards a sustainable development. Besides working in inclusive volunteering, we also do political lobbying and campaigning. So bezev is a member of various committees and expert groups. And we also offer counseling and information around questions that deal with disability and development. And we are also active in education for inclusive sustainable development, where we prepare educational materials for school education as well as for non-formal education. Now I'm coming to the inclusive volunteering. bezev has experience in inclusive volunteering since 2008, when it became a sending organization in the Weltwärts program. That is a German volunteer program of the Federal Ministry of for Economic Cooperation and Development. It is designed for young people between 18 and 28, and if the person has a disability, even up to 35. And from the beginning, bezev was promoting the participation of young persons with impairments and lobbied for more inclusive guidelines. Up to now, bezev has sent around 65 volunteers with a disability and impairment abroad, and by that has quite some experience. So besides acting as a sending organization, we have a wide range of consultation services, as well as for people with impairment, as well as for organizations, and we share our experience and promote inclusive volunteering also through networking and exchange. And we also have a lot of information material, and we have trainings and workshops. And in general, we lobby for inclusive program guidelines. This is our slogan for our inclusive consultation service, so to say, so where people with disabilities can get any information about volunteering abroad that includes all the different programs and other possibilities. The slogan is just do it, and on the image below you can see a globe with two persons sitting on it, one male, one female, and written across the globe is written just do it, worldwide volunteering for all. And here I want to introduce our handbook, Just Do It Now. This is giving some information about how to do inclusive volunteering, how to do the seminars and so on. And it is available in English, French, German, and Spanish. So, all right. Having now talked about all our experiences, I get to the challenges we face with COVID-19. This is something, well, this is a challenge to an extent we never had before. We do have challenges in all stages of volunteering. So this means many programs, the volunteers do start in the summertime and returning next year summer. So for the moment, we have 3 groups to deal with. This is the ones who left, the volunteers who left in summer 2019, then the ones who will or should leave this year in summer, and the ones who want to apply to become volunteers next year. So for the ones that left last year in summer, they were in the middle of their assignments when they had to return on very short notice. So there was only a couple of days or weeks, some only days, for them to prepare everything. So from the point of organization, it was a very difficult time for us to organize and to communicate and to inform everybody, to check the tickets, to check the flights. And but it worked out quite well. We have one volunteer with a physical disability. We didn't have the time to arrange somebody to accompany him on the flight, so he went unaccompanied, but everything went well. So what is said by all the volunteers, regardless if with or without disability, was that it was a sort of a traumatic experience, and the sudden return, some couldn't even say goodbye to their colleagues and friends, and so afterwards a lot of support and talking was needed. What has happened, how it will go on, if there is a possibility to resume the assignment and maybe go back to the country they did their volunteer job. And what we thought was more difficult for the volunteers with impairment was to find something to do in Germany, because as they were seen as a risk group, they were not. They were highly advised to stay at home and not go out or work or do something in a local context. For the volunteers that are that should leave this summer, I titled it "Planning Without Certainty." So for the moment, we have a travel warning in place, so nobody can, none of the volunteers can leave, and the travel warning is in place until end of August. And it is very likely that restrictions will continue, especially for the countries outside Europe, but still the planning and organization is going on. So we apply for the cost coverage of special needs that need to be checked. How can they get paid? How can they get financed? And this is very difficult to calculate, because we do not know when the people will leave. So how many months to calculate? Big question. And also there are some expenses like some examinations or treatments in the local hospitals, we need to know how much they are, but the partners there do not really want to go to the hospitals to ask for the prices and for the possibilities, and sometimes it's not possible to just write an email or call them. So there is a lot of uncertainty and a lot of questions around that. And in general, it is difficult to get reliable information about the state of the healthcare systems in the host countries, just to make sure is it safe and okay to send volunteers at all. So this is a big responsibility as well. And of course, our partner organizations are very careful as well. They don't want to risk an infection of a volunteer. And the parents of the volunteers are worried and are raising their concerns, all very understandable. And because of all these uncertainties and questions, some volunteers already decided not to go. So they backed out and decided in general to stay in Germany for now. And for the other volunteers, they have to think about how to bridge the time until departure, what to do until it is possible to go abroad, especially for the ones who are working and have a flat. This is a big question because they don't know when to quit their job, when to leave the flat, and so we have a lot of question marks around it. The third and last group we are dealing with is the volunteers that want to leave next year. So for many programs, the application period has started or is about to start. And this at the moment we have, I would call it something between business as usual and unpredictable development. So we receive pretty many phone calls and emails from young people with impairments that think about going abroad and want to know the possibilities and want to know what programs there are, how is the application process working, and so on. So we all give this information, but we are not sure what will happen and what will be possible to do. So that is the situation at the moment. We try to cope with it as good as possible, and we are alert and we observe what is going on, and we hope that the pandemic will be under control. The sooner the better, and that persons with disability and impairments, especially in the global north, have access to all the services and treatments they need. And yeah, that is our challenges and our experiences so far up to today. Thank you, and I'm looking forward to your questions.
Thank you so much for this presentation. So you brought this dimension. Of course, the whole world has been turned upside down with COVID-19. Our work
Absolutely.
domestically in each of our countries, everything that involves travel. So of course, the planning for a volunteering experience, whether you're on a volunteering experience, planning one or returning from one, the world has completely changed and everything needs to be reevaluated. And I suppose what you're really facing now as well is we're really uncertain about the future. And so all of the planning that you can do, it's, you know, the situation can still change. So I want you, it's very good, Regina, if you and also all of our speakers stay for the questions at the end. I noticed already we have a very good question in the question box. So I encourage participants to use the question box, and we will have all the speakers come back at the end. The question that we have now is on how extra additional costs might be covered, for example, for reasonable accommodation. How is this factored in? So all of the speakers will have a chance to answer this question and others towards the end. But I would go now to our next speaker, who is Shane Halpin, Shane is the CEO, so the Chief Executive Officer of one of Volunteerism Christie in Ireland, which is one of the partners in this project. Shane, it would be wonderful if you could also introduce yourself. You're going to share your slides as well, I understand. Regina, you can switch off your video for now and then come back to us again later. Oh, you have your slides shared already. Perfect. So Shane, I'm going to switch myself off so people can focus on you while you're speaking. You're very welcome this morning.
Good morning.
You're very welcome.
Okay, so very good morning, everybody. When I was asked to talk about inclusiveness in the context of being a volunteer sending organization, I was challenged, to say the least. How do we at Volunteerism Christie work to be inclusive? This engagement in the VIVID project has certainly begun a journey for us. In today's talk, I would like to speak specifically about how we try to be as inclusive as possible, both in terms of the project design and the interventions we offer, but also give some insight into our aspirations for the organization as a whole. So a little bit of background. Volunteerism was originally set up to send volunteers and lay missionaries to support the Irish mission overseas. That's predominantly priests and sisters of the Catholic orders. And over the years, it has developed and transformed into a needs-based development humanitarian support organization, still specializing within the faith-based sector. As a development practitioners, our aim is to do ourselves out of a job. And we do that using local counterpart training. And we aim to move towards mentoring and engagement of local staff and long-term sustainability of locally managed projects. Our areas of expertise include project management support across multiple sectors, including health, education, income generation, and human rights. Our mission, therefore, is to work in solidarity with our partner organizations to help improve the lives of local people, and we do this by improving access to basic services. Our strategic plan states that VC is an inclusive organization, and I quote, "We warmly welcome and work with everyone, regardless of faith, beliefs, gender, sexual orientation, disability, race, nationality, or ethnicity. We believe in a participatory, positive approach." We have a long history of working with partners who provide lifelines for people living with disabilities all over the world. Over the years, we have sent teachers, physios, speech and language therapists, audiologists, as well as skilled volunteers in the areas of project management and project development. Since joining VIVID, we have become aware of Disability Inclusive Development, DID. We never called it by name, but we do use many of the elements. All our funded projects use a cross-cutting lens to find out more about the environment that we work with, social justice and human rights, gender, HIV, AIDS, and the environment. Beneficiary subgroups also tell us about the number of persons living with disability and marginalization factors such as the number of refugees, the minority ethnic groups, etc. within the area. We work currently with over 30 partners. And before we initiate a partnership, we carry out what we call a due diligence process. This entails a detailed examination of the organization, including their governance, their management, their finances, their strategy, and also a rationale for overall project support. As part of this, we carry out a SWOT analysis, strengths, weaknesses, opportunities, and threats, and we draw up what we call a risk matrix. This is when we ask pertinent questions in terms of best practice development. Is the project fulfilling a need? Is there a child and vulnerable adult safeguarding in place? Is there equal and inclusive access for all? Is the project focused on those most marginalized in society? And will our engagement have a cascading effect on the project sustainability and growth? If the due diligence is approved, we then move to project development stage, which includes visits to the project locations. Our key donor demands a very high level of compliance and best practice. So once again, the areas of DID are encountered. How does the project ensure that all beneficiaries be afforded equal access to education, healthcare services, and employment? Has a household survey been undertaken, for example? And what level of inclusion was involved? For disability-specific projects, we would need to show clearly that the project has made or intends to make it is accessible for all in the target community. We aim to integrate as many voices as possible into the proposal. We engage with beneficiaries, their elders, street children, a whole range of different people. If there is a volunteer required, we only recruit and deploy someone who meets the need as identified locally by the beneficiaries and the partner. The demands of today's projects and project management require a high level of qualification for the volunteer development worker. We advertise the role. We open it to all who are suitably qualified and experienced, and we aim to choose the best person for that role. The volunteer will be trained fully and tasked with helping to build leadership and capacity locally. All of our projects specify that the volunteer must work with at least one local counterpart, so that the capacity is being built at the local level and the work is sustainable. Our funded projects always entail data capture and analysis to measure how effective the project has been. So we conduct baseline surveys at the design stage, but also at the end of the project life cycle. Voices of the beneficiaries are captured in all of this. Feedback and learning informs future project design, and VC work hard to respond to the changing needs. So an example of volunteer inclusivity, we have a volunteer which has recently come back from a school inspection project within central Uganda. This is a grassroots project, ultimately to mentor local school inspectors to ensure that their schools are providing access to quality education for those who need it. And how did we measure it? How did we deal with inclusivity? Going down layer after layer to talk directly to teachers, to talk to the parents, to talk to the carers and the kids themselves, asking questions like, why don't they come to school? Why don't teachers turn up? Why do girls get married so young? Etc. Listening to the voices. We set up systems that allow children to remain in school. We ask teachers about their needs. We support them. We tell them about their entitlements and rights. We show them how to access services without fear. We create awareness around disability and special education needs. Some see that as cursed or possessed in some way. And so discussions around including these children to address the fears, the set of access to state services, etc. So when the crisis hit, the virus crisis, the COVID experience in Ireland, meetings were held with the VC crisis management team and different scenarios were presented. We took a decision on March the 18th to bring our volunteers back to Ireland if it was at all possible. And on Wednesday, the 19th of March, we went into lockdown. So most of our volunteers came home, not all, but we had a comprehensive handing over to the projects to ensure continuation at a local level. Again, the inclusivity came into play, more listening, acting, and taking into account the local needs in a new and changing climate. More listening to local beneficiaries about the impact of COVID-19 on them. The disability services were closed, the schools were working remotely, elders were isolated, potential outbreaks of COVID-19 were experienced in the refugee camps. What could be done by us to make sure that their voices are heard and the support was given? So this translated into our funder, thankfully, to redirect existing funding to support beneficiaries and to ensure the continuation of our projects. Local field staff now take on a greater oversight and management role, and we continue with our support. So the key learnings for us, I think, is that we are actively using DID, development inclusive, disability inclusive development, in our project design and requirements, definitely from a field perspective. As an organization, we are strategically pursuing the goal to be an inclusive organization. In September, our venture training program, as a result of COVID, is opening our doors to the Southern Hemisphere applicants at reduced or no cost as we go online. However, we still need to be exclusive in some cases, particularly with regard to selection of volunteers, because we require them to be resilient, healthy, qualified, adaptable for the challenges of today's volunteering. So COVID has fast-tracked the handover process to local staff, which is an exciting thing in itself. It is strengthened by our existing mentoring approach. We've incorporated local volunteering, different ways of operating, including dealing with the complexities of monitoring and oversight. Vivid has opened our eyes, this project, to the potential of being more inclusive in processes and accessibility issues, not just for our partners, but for us as humanitarian and development organization. So I thank you this morning for your time. And if you have any questions at the end, please feel free to ask. Thank you.
Thank you very much, Shane. So now, following Shane's presentation, we have our last speaker this morning, and I'm going to have a conversation with Vibhu Sharma, who is joining us from New York. You're so welcome, Vibhu, this morning to join us. Can I hear you, just so I know our connection is good?
Thank you so much, Sharon. Absolutely my pleasure to be on this webinar.
Wonderful. So we're going to have a conversation to hear about your experience and your views before we go to the question and answer session afterwards. So my first question is, what time of the morning is it there in New York?
4:06.
So thank you so much for getting up at this time. So I first would ask you to introduce yourself so people know a little bit about you.
Sure. You already know my name. I am from India and currently based in New York, working in the policy section of the Office of Human Resources at the United Nations Secretariat. And I'm part of the UNV talent program for young professionals with disabilities. At a more personal level, themes such as equal opportunities for persons with disabilities, disability inclusion, inclusive education, equal employment for persons with disabilities are personally very close to my heart, and I think I'm very fortunate to be working at the UN, concentrating or focusing on some of these areas in my assignment. So I work on HR policy, staffing and diversity, and a lot of my focus is on increasing diversity and disability inclusion within the UN.
Wonderful. Could you tell me a bit more about the UN volunteer program that you are in and the experience that you've had so far?
Sure. That's a great question, in fact. So the UNV talent program for young professionals with disabilities is basically a program or an initiative that aims at bringing people with disabilities within the workforce. Now, as we already know, there are two kinds of challenges when it comes to employment for persons with disabilities. One is that a majority of employers do not want to hire us, and secondly, persons with disabilities, like everybody else, face this challenge that employers only want to hire people who are coming with some experience. But now, how would you get this experience unless you are hired? And because nobody wants to hire you, there is no way you can get this experience. So what the UNV program does is to hire people with disabilities for a temporary assignment, and then it gives them the work experience to work in an organization and get employment skills. The beauty of the UNV program lies in two things, which is one, that although it's a volunteer program, and they call it a volunteer program, maybe for a lack of a better word, but it's very different from many other volunteer programs that we have. For example, I have personally known a lot of people for whom volunteering is limited to walking into your local organization and saying, I want to volunteer, and then they give you whatever is available with them. So basically there is no supervision, nobody is monitoring what you are doing. As long as you are saying you want to volunteer and you are delivering on whatever was given to you, that's great. But over here, there is a proper mechanism. There is a very rigorous application and selection process, which is what happens in any job application anyways. And and that makes the UNV program unique.
And you've described generally how the UN volunteer program is in general, and where you come from towards that. How would you say is the UN volunteer program inclusive?
I think inclusion is what makes the backbone of the UNV talent program. So, and not only does it hire, as I was saying earlier, persons with disabilities within the program, but it also is very careful about providing them reasonable accommodations. So I know that some colleagues with hearing impairment have got sign language interpreters. I have a visual disability and I have a screen reader on my work computer. And so at various levels, the program really focuses on considering the specific needs that persons with disabilities who are volunteering within the program could have, and then respond accordingly.
Excellent. And now, because you're based in New York, I'm very interested to know, because New York, like many countries, like where I'm based here in Belgium, has had a very heavy impact on the population of COVID-19.
Mm-hmm.
Have you been a volunteer based in New York throughout the COVID-19 crisis?
Yes, I have.
And tell us how that has been for you as a volunteer from India in New York while all of this happened.
That's a very relevant question given the global crisis we are all grappling with. Because, as I was saying earlier, my work, because it is relating to policy, so the way it affected my work was that we could not focus on what we had initially planned to do at the beginning of the year, and had to shift the focus of our work to what we need to do now during the crisis and in its aftermath. And given that the measures for physical distance continue to be in place for some time, one way in which it did not affect my work, and I'm happy about it, is that because of the technology that we use, and because we have accessible technologies installed, I could continue to work as independently as I used to do earlier. But I mean, when I think about hundreds and thousands of young people with disabilities who do not have access to technology or appropriate technology, it shivers down my spine to think what it could be like. I did not personally have any challenges due to the COVID, because, as I said, my work being largely policy-based, desk-based, and working on computer was not affected. But at a personal level, I did have some challenges. So, for example, and it's a funny thing to mention, but anyway, for over here in New York, we ran out of grocery deliveries for some time. So I had to kind of plan my orders much more in advance if I did not want to be out of food. But then this is something very similar to what everybody else who was depending on deliveries was pretty much facing. So in that sense, I did not have much of a challenge.
Well, yes, the deliveries issue affected many people around the world as well. And I would just finally, we do have a question for you, actually. I'm looking at the questions panel. So as the other speakers get ready.
Catherine?
Yes?
All of the videos are frozen, just so you know.
Okay.
So there's no interpretation happening at the moment.
Okay.
But it's a GoToWebinar issue. It's not because all of the videos are frozen.
And can people hear me?
We can hear everyone. I'm just letting you know.
Okay, that's for the sign interpretation. So I'm sorry, everyone. I just slowed down a minute because we want to resume when we have sign language interpretation working. Sorry, Vibhu. I will resume as soon as we see just a resolution on the video problem.
I'm now connected. I don't know if you can see me. Yours is frozen, Catherine, just so you know. But I seem to be on. I don't know.
Okay, hi, sorry. It's Raquel. I see Catherine and the camera is on. Lisa, your camera is also on, but I see only black. I'm stopping it and trying. Sorry for this. Yeah, it's not working. Wait.
So I just
think you can
know I'm waiting.
Yeah, I think you can. 1 minute, please. 1 second.
So I'm
Yeah,
just letting everyone know that.
People are saying that your camera is not frozen, Catherine.
Okay. Okay. So we have live captioning. And so you see in the chat box the link for the live captioning.
Yeah.
We're just trying to get the sign language interpreter back on video on screen. Vibhu, I was going to ask you one more thing. I see Lisa now.
Okay, we can see you both now.
Perfect.
You're back.
So
okay.
I have some questions for all of our panelists. So I hope that our panelists are alert, but I'm going to start with you, Vibhu, because somebody has asked, let me check exactly who. I'm going into the questions panel. They've asked, have you received mentoring in the UN volunteer program?
Great question again. So as I was saying earlier, that there is a very formal mechanism that the UNV program operates with. So generally what happens at the UN is that anybody who is working has a supervisor. I mean, that's what happens in any organization. So I do have a supervisor who I report to, and I think my supervisor would basically mentor me on what I have to do and how I have to go about it. Some of the policies are obviously new to me as well. And that's who I go to for any questions or any doubts or any mentoring that I require.
Now, Vibhu, were there any other things that you wanted to tell us about the program before I go to some of the other questions which have come from participants today? Were there any final words? Because we got a little bit interrupted there at the end when the video broke down.
Not really, but I would be more than glad to answer any other questions.
Perfect. So I have the first question that I will ask you, but it has also been directed to our first speaker. But is it okay for, I'm just asking my colleagues, if it's okay if I let the other speakers put their videos on so we can see the panelists? Perfect. I have Regina there. Thank you very much for coming back, and Shane and Charlotte. So the question I have for all of you, and any of you can take this question, is what are the best ways of covering reasonable accommodation costs? Because this was a question that was first directed to Charlotte. So would anyone like to come in on this with the solutions that they have or that they know about?
Well, I
Charlotte,
can give it.
yes.
Yeah, I can give
perfect
it.
too.
Yeah, absolutely. Yeah, based on the reports and the things that I read when I was compiling that background paper, some strategies were to seek funding when it is from a state source, to seek funding from the aid agency that funds that program directly with the funder. So to advocate to, in the Irish context, it would be Irish Aid, or in the German context, it's the German Ministry of Development Cooperation, to provide that additional funding and reasonable accommodation. And then one of the problems that volunteers sometimes encounter is that their social covers that they would receive while they're placed in their home countries don't apply when they're on an international assignment abroad. So it could be a good strategy to also make sure that they're available to receive those additional fundings while they're on deployment through a volunteer service. I don't know.
Thank you very much, Charlotte.
Yeah.
Thank you very much, Charlotte. Regina, did you have anything to say on the reasonable accommodation costs?
Charlotte got it quite to the point. I think there are some programs where you can get the cost, so the volunteer doesn't have to check out the money for her or himself. And that is what everybody tries to do, to find out where is the possibilities and which programs and which other mechanisms can be used to get the money for it.
And Vibhu, do you have anything to say about this? Are you aware of how it's dealt with? Are there good practices within the UN or the UN Volunteers Programme?
What I'm aware of is that once any position is advertised within the UNV talent program, they already take into account the budget that they need to have for reasonable accommodations. At the same time, the UNV program also concentrates on any unforeseen needs that might arise. And once the application process is over and the candidate is selected, the program really takes time to understand from the volunteer what their reasonable accommodation needs could be so that they could factor all of that in before they actually onboard the volunteer. But yeah, I guess my colleagues at the UNV would have more information on this, and I can definitely get back with that information. But as of now, this is what I know.
That's perfect. In any case, we're at the moment all together as project partners learning about best practice and how to bring that together. So sending organizations will in the future have a resource of best practice available. Now I have a very specific question for Regina. So our Rebecca Daniel says, thanks a lot for the good insights into the challenges of volunteering work during COVID-19. I have one question for you. Do you have any feedback as for which countries bezev, the German ministry, decided not to send volunteers with disabilities once travel restrictions have ended? Are there certain countries to which you usually send volunteers which you already know they will not be able to receive volunteers later this year due to COVID-19 related health situation? So do you have any specific country-specific information, or even could you tell us how you're thinking through this problem?
At the moment, we do not get any information of that kind. We know there is the travel restriction until end of August. Further on, I didn't hear about any more information or special that one country already is sure you can't go there. For the moment, we do not know. Everybody keeps their feet still and is waiting for what is going to happen.
Thank you very much. I think this actually reflects the planning that most of our organizations are doing across all our fields of activity. So for example, in response as well, we're looking here in Belgium at what the Belgian government is giving as public health advice domestically, and then for the Ministry of Foreign Affairs, what they're saying in relation to travel. But of course, planning one weekend or a week somewhere is very different to planning to be somewhere present for 1 year, which is often the case with volunteers, which creates even greater uncertainty because the pandemic is evolving differently around the world. So I guess living with uncertainty and being flexible is one of the things that we're all learning during this time. Now I have a question for all of the presenters. So for you, Vibhu, and for our presenters here on screen, how have you dealt with and resolved the issues around COVID-19 travel restrictions within and between different countries for volunteers? Do you have any good practice or any ideas to share with our participants on this around travel restrictions? Vibhu, can I come to you first? Because sometimes when people are not on screen, I might forget about them. So I'll give you the word first on the travel restrictions and then go to the other panelists.
Sure. I'm honestly not sure how the program in general is intending to do it. My personal travel everywhere was cancelled because of the restrictions, obviously. And then obviously I do have uncertainty about being a person with disability, needing certain kind of assistance when I undertake travel, and then with the physical distancing measures being in place and the travel restrictions being in place and me being in an other country, I do personally have worries and hesitations about how am I going to travel home if I need to. But I honestly do not have any idea about how the program is intending to deal with travel restrictions.
Okay, thank you very much. And other speakers, do you want to talk a little bit about how you've handled travel restrictions? Maybe I'll go to you, Shane, first, because I didn't come to you on any of the other questions.
Yeah, okay, thanks, Catherine. Well, to be honest, we have taken guidelines from the Department of Foreign Affairs and others with regards to sending people overseas. So all our programs are currently on hold. We had a horrendous time trying to get people out of the countries that we have deployed in. So we haven't rushed back into this situation again. It's been a real challenge, you know, with the way the insurance companies as well are dealing with it. There's a lot of issues, as you probably are aware, with regards to getting coverage for volunteers and so forth. COVID has thrown up a lot of challenges. So we're not going to be sending volunteers in the short term. Short to medium term. I really don't envisage sending anybody else this year. You know, even if we could, I think there would be challenges of getting insurance.
Yes.
And partly, you know, I think the challenge is also if something happened to the volunteer while out on the field, it's all very well dealing with them in their home country, but when they're overseas, double the trouble and double the challenge. So that would be our position at the moment, on hold.
Yeah, and so in the short to medium term, you're not sending people on volunteer programs. Do you imagine, as you look forward to the next few years, imagine that the pandemic settles down and restrictions are lifted? Do you see any longer term changes to how you would manage the volunteering experience or the planning based on what you've learned during this pandemic?
Yes, that's a good question. I think we're learning all the time. You know, I think in my presentation I alluded to the fact that we are looking towards more local engagement. So volunteers that traditionally might have come internationally now are coming from the local environment. So we've had a long experience of walking the journey with partners in places like Uganda and Kenya and others. And now what we're finding is that we're trying to say, okay, who can we link in? Who are the experts within the local community that we can engage, if only on a temporary basis? But so what we're trying to say is let's really try and include the local people in this and their future. And you know, our understanding of development is, as I said in the presentation, is to do ourselves out of a job. And that means a volunteer might not always be required. And I think we're probably moving to a more mentorship role, a mentorship model, where we would be trying to build capacity, maybe online, with volunteers on a local basis. So there's different ways that we're going to have to think about the future, to be honest.
Yes, yeah, I think every organization has short-term issues. So what do we do this year? And then longer-term issues, how do we change our work to accommodate this? And also learning like how much we can do online and maximizing that. And also your idea of maximizing use of local volunteers and local expertise sounds like it's completely in line with your organization's philosophy in any case. So this gives you a push there. Do Charlotte or Vibhu or Regina have things to bring in on this point, looking at either travel restrictions or long-term changes in how we work?
About the travel restrictions, because all our volunteers came back home in March, so that wasn't so far a big issue. For our seminars and preparation for the volunteers, there wasn't the travel restriction, but the social distancing. So we did it all with online seminars instead of physical meetings. So that wasn't a big problem. In the longer term, I think for sure everybody, the whole volunteering community needs to think about measures what to do, because now that COVID-19 is here, it won't be gone tomorrow. So right, so that will be a problem we will have. I do not know, probably for very long, and so we need really to think about what things should be done, what is possible, and what isn't possible anymore, or not that easy anymore. So.
Thank you. Does anyone else have anything, remarks to make about travel restrictions and how they've affected your work? So now I don't see other questions. Am I correct? I'm just checking with my colleagues that I'm not missing any questions that might have come in. So I don't see other questions. I'm just checking. Oh. So one last question I have about alumni groups. So the alumni are the people who have graduated from your volunteer program. Do you have networks of, for example, Regina, you have I think you said you've sent 65 volunteers with disabilities overseas. Shane, I guess you have over the years accumulated many volunteers, alumni, and I guess Vibu within the UN volunteer program, but I think you haven't been, you may not have that information. I'm interested to know if there's specific networking that would bring together your former volunteers or volunteers with disabilities that would help them kind of build and capitalize on their experience. Should I go? Shane, I see your mic on.
Yeah, well, I think Via Torres Christi is founded on alumni, I suppose, the members. We're in our 60th year this year, so we've got a lot of people that have sort of built the organization over the years, and we rely heavily on engagement in people. It's a membership organization, so people join as a member to be going overseas, and we sort of see it like a union of volunteers. That we there to represent their best interests with the partners, and come to the rescue in situations where they're challenged in the field and so forth. And so when they come back, we find that they get involved with us in various ways, like whether it's through fundraising programs or through talks in schools, through different things. Like this year, we're celebrating our 60th anniversary, and the groups have come together to organise speaking events in parishes and parish halls and stuff around the country, and events to mark the centenary and talk about the history and how it's changed. So yeah, we definitely see it. And probably increasingly challenging to give something. With the world is becoming so small, it is challenging to see how best to interact with, and what are their what would bring the people together. And once they've done, we find that they're very interested in the first few months, 6 months, 8 months, year, whatever, when they come back. But then, how do you maintain that engagement? I suppose that's the challenge for us.
Yeah. So they're really part of your organization. Your alumni are really like the lifeblood of how you keep running. And okay, Charlotte, did you have anything in your research that you saw on alumni experience, particularly with a disability angle?
Yeah, one of the things I actually came across was that it is very important to match volunteers that are about to prepare for deployment with volunteers that already were abroad, so that there is a peer-to-peer learning directly from those who have that experience and working in a host community with those that are currently preparing their stay abroad, so they can share their experiences and learn from one another. And that is a very authentic learning experience to hear from those that have already traveled abroad.
Well, thank you very much. And Regina, are you still with us there? I don't.
Yeah,
I
you
don't
can't
see
see me, but I still am here, so don't worry.
Perfect. Perfect.
Now,
Would you like to tell us anything that you have to share about your how you keep engaged with your alumni after they've come back from their volunteering experience,
yeah,
or before?
we have a group that is called People for Inclusion, and their former volunteers or people who are interested can engage. This group is pretty new, so they are still on a finding process, but they have very great ideas regarding peer-to-peer counseling to inform other interested volunteers how it is to go abroad and what is needed, and share their experiences to make it more realistic for a lot of young people to think about volunteering, because this is something that is not in everybody's mind, especially not for people with an impairment. So sometimes it is the first time they hear about it when they meet people from People for Inclusion, and so very, very important. But this is not. We are still pretty much in the beginning, but they have great plans.
That's very interesting. And Vibhu, do you have anything to say about alumni networks?
Sure, I think one important thing to remember about the talent program is that the program is still young, if not entirely an infant. And we do have people with disabilities who have served earlier in the program in other UN duty stations. So what the program does is that when the new volunteer is onboarded, it helps connect the newcomer with people who had previously served as volunteers within the program. Other than that, we have few social media networks as well. There is a group of the volunteers on Facebook or on LinkedIn to keep people connected with one another and share their experiences.
Thank you very much for the good question and also for all of your answers. Now, I don't have other questions, but I just wanted to give all of the speakers a chance if there's anything that you wanted to share with participants, or indeed to tell to EDF for the next steps of the project that you think we should be aware of, or that we need to research more. I'll go just in order of how you spoke to see if you've got anything. Charlotte, is there anything, any last words you'd like to share with us?
Well, thank you, first of all, to having me here today. And then maybe one thing that from CVM's perspective is that the Vivid project is actually currently preparing some guidelines for inclusive volunteering. So that's definitely one of the things on the agenda of the project. So yeah, that's it from my side. Thank you.
Perfect. Thank you so much, Charlotte. And Regina, do you have anything to share finally?
I also want to say thank you very much for having me here. And if there might be any questions from participants, just feel free to email them to me, and we will see what we can do. Thank you.
Perfect. Thank you so much. And how about you, Shane? Any last remarks?
Okay, sorry. Yeah, no, just thank you, Catherine, for the opportunity. I think it's as I said at the beginning of my talk, it's a journey. This entry into inclusiveness. I mean, it has been very much on our agenda from the point of view of the people we work with. But from an organizational perspective, and for me as CEO, it has been an enlightening process so far to see how we can improve and how we can engage in being more inclusive in the work. And so yeah, so the next stage for us is really to practice what we preach, I suppose, a little bit more, because we are very, I think, having written that speech, we are quite inclusive in terms of how we deal with development, but in terms of how we deal with our own processes here in Ireland, I think we have a little bit to go. But I think I've taken the baton on now, and I'm looking forward to running with it. So thank you to Vivid and to the EU for their engagement on this, and yourselves.
Yeah, and this is why we're in the project together, because we all have things to learn from each other. And that gives us an opportunity during this project period to, as Charlotte mentioned, we share experiences and guidelines, and at the end we've all strengthened our abilities to do inclusive volunteering in the long term. Vibu from New York, do you have any final things you would like to share with the participants?
No, thank you so much for having me here this morning. It's been a great experience, and I'm very excited about this project that EDF is doing. And if there is any way I can collaborate, I would be more than glad to.
Oh, that's wonderful. We were so happy to be able to bring you all together today this morning, and I wanted to just thank all of you for your time, your preparation, and everything that you've given during the conversation. I want to thank Ferdinand and Lisa, who've been interpreting, and also Wim for captioning. And then, of course, my colleagues who've been organizing the webinar. So this is Raquel, many of you were in touch with. So we're all working remotely at the moment. Raquel is helping us with the planning of all of our webinars, and our new team member working on this project, Diana, is also here with us helping today, and Marion. So I would really want to thank you all for the planning and preparation. And as I mentioned before, we will send an evaluation because we really want to hear from you all on how to make improvements, what was good, what we need to improve for the future. And the recording will be available for everyone to look at, as well as the presentations. So thank you very much all, and I wish you all a really good day. Bye-bye.